Good morning, pharmacy. Can you hear me? Yeah? Happy Monday. Okay, we'll go back to our usual. Thanks, my love. You will go back to our usual. How are you today on Monday? And our Monday motivation, since we just started a new class and we have a little bit of time. Okay, so I want to go back. I really wanted to do the Monday motivation as much as we can. Okay, how are you today first? Anthony, Tony, how are you? How have you been? Remember three most powerful words I said, how are you? And when you ask that, stop and really listen to the answer, okay? How are you?
I was gonna do that automatic answer and just be like, I'm fine. And then I thought about it and remembered what you said. But I'm doing pretty good. The weekend was nice just with the family.
Just
So it was pretty good.
the weekend was nice for you? What
Yeah,
did
it
you
was.
do this weekend?
Not much, but it was just with the family. So it was really nice.
Oh yeah. Um, anything? I know Kevin always goes out to eat, so let's see that. Let's hear it. And I love food. Okay, so let's hear it from Kevin. Nice to hear, Tony. No cooking in the house now, Tony. Nothing special like cooking in the house.
No, nothing too particular like that. Nothing.
Okay, gotcha. Kevin, let's see where Kevin ate this weekend.
Good morning. Good morning, ma'am. How are you?
I'm good. I just had a lot of things to do. I attended a funeral via Zoom. It was tough, but it was nice to see how loved she is and how good a person she is. Those are just living testimonies. It's weird attending a funeral via Zoom.
Yep,
So
sorry.
it's heavy, and it's also fun because I got to see pharmacy school friends. Anyway, back to you.
Weekend was pretty good. I did go out to eat again. um, so yesterday, it's kind of a fairly recently open restaurant, burger, bar. I don't know really how to describe it. In Town Square, it's called Sicky's Garage and Burgers or something.
Sicky's Garage. Okay.
Yeah, it's like right next to the park.
Oh,
Yeah, so it's really good food. I ended up getting like I guess like their specialty, which is basically two grilled cheese as buns, and then you have a cheeseburger in the middle with bacon.
wow, I love bacon.
Right, yeah, and it was just cheese overload, and it was delicious.
I love
And
cheese. Oh my gosh. Nicole was like, no, Nicole, are you a vegan?
No, I'm not a fan of cheese though.
Oh, wow. I'm a cheesehead. There has to be on the
yeah,
average 5 cheese in my refrigerator at any given time.
yeah,
Average.
yep, same.
Okay,
Really
that's
good
good.
spot.
Why is it called garage? Is the theme like a garage?
Yes,
There's
so it's
cars?
like yeah, so as soon as you walk in, they have like two like vintage like gasoline dispensing, like units. And then you
Oh,
go inside and they have like license plates, they have like car parts scattered about and stuff like that. It's really unique.
oh, that's
Yeah.
cool. It's something to check. Okay,
Mhm.
something to check out. I love trying new restaurants. I'm not scared. Prior to the pandemic, just so you know, I'll tell you a little bit about our culture or our tradition, okay, at the campus, because you did get that chance, okay? We do have potluck, okay? Others call it fiesta, others call it potluck. And this happens on week 6, either a Thursday or a Friday. I usually do mine on a Thursday. The whole campus do theirs on a Friday. Okay. So I do mine on a Thursday because Friday is final exam. So I don't like my students thinking about that. I used to do it same day as Friday exam, and I realized, plus this is a good thing. So if you have friends from other programs, you can go eat at their potluck on a Friday and they can go eat at ours on a Thursday. That's why I'm the one who did it on a Thursday. So, but the entire campus used to do it on a Friday. So that's a potluck. Everybody tries to chip in or brings in a specialty dish made by themselves or by their moms or something that we can try. And it's really, really fun. And I've tried so many different food because of that potluck. Okay. And students always ask, Miss L, did you make this from scratch? Yeah, when I bring something. Yeah. And I always say, yeah, I made it from scratch. I scratched my credit card to get it. Because I really don't have time. I don't even have time to cook for myself or my family. So yeah, I did. It's like a big thing when you make something from scratch, right? So even holidays, I scratch my credit card. So I'll try to find a caterer or something. Well, every now and then I'll probably cook. It's just frustrating when you try to cook and then it doesn't turn out good and you wasted all that time and you really don't, not that I don't like, but I really don't have time. So anyway, just so you know, that's what's going on in the campus prior to the pandemic. And I'm pretty sure we're going back to that once we go back to the campus August 4th. Maybe not right away because of the spoon or the serving spoon and stuff like that. But it's a fun thing. It's a tradition that we've had. I've been with Pima 11 years. It's the tradition that we've had since I started with Pima. So it went on and then it just got passed on to instructor after instructor, even if they're new instructors. And it's always fun to try new things, new food, especially cooked by your families. So anyway, and I'm like what I said, I'm not scared to try food. I'm very open to trying food like that. I've tried so many different ones because of students. Okay. Eileen went camping or glamping. Eileen, how was it? You went to Utah?
Yeah.
Zion, Bryce.
Zion.
Zion, how was it? It was windy the last.
Yeah, it was cold. First,
Oh,
we started out camping in the camp, like set up our tents and stuff. And then the next night, we're like, we're gonna get a cabin. 'Cause
yeah.
It's were cold, so yeah, we stayed in a cabin the next day. So we experienced both.
Oh,
It was
that's
fun. Yeah. Oh yeah. See.
I like Zion when I went there like a couple of was that like a month? Okay, I really love it. Okay. Is there still snow, you said?
No snow.
No more snow. Okay. When I went there, it snowed the night before. So it was beautiful when I woke up. So anyway, it was fun family time. I'm glad you got to get away and spend time with your family, with the little kids. I think I only took my son. I really never did camping, but glamping. It's either RV or that fancy fancy tents. Yeah, because I'm not a camping person, so I'm scared to do that full on camping. Maybe later on with my son. I love the outdoors. It's kind of sad that it's gloomy. I don't know. Is it gloomy out there? Okay, it's gloomy in Henderson right now, just so you know. Okay, who's from Henderson? Hands up. Henderson. Just me? Okay. Miss Trisha's from Henderson too. So you're all from Vegas. Who's from North Las Vegas? North. No one? Okay. So all at the center. Okie dokes. How have you been, Robert?
I've been fantastic. Let me tell you. You know what? That
I just saw
Friday,
you last. Yeah, this is perfect. Tell us about it.
Friday, I went to California because my mom's cool, and she had like a timeshare there.
Which one?
Yeah.
Where?
We had like our little timeshare thingy in Oceanside, and then
So which part of California?
I don't know. I don't live there. I'm
It's
not sure.
North County, San Diego.
Thank
I was
you.
about to ask, is it San Diego area you're talking about? Okay, got it. Because Kevin was based in San Diego. That's why I think he's familiar.
Thank you, Kevin. You're a
Yeah.
homie. Anyways, so yeah, I got we left Friday, and then I got there Saturday morning, like really early in the morning, like 2 in the morning. And then we went to Venice Beach and it was cool.
Oh,
then-
I like Venice Beach.
Yeah. And then yesterday I went to I think we went to Redondo Beach. We got some like seafood there, and then we went to
Yeah.
Manhattan Beach. It was really nice. The water
That
was
was a
cold.
lot of beach over the weekend. You went to all the good ones.
Yeah, because if I tried swimming out here, I'd get dusty. And
Yeah,
then I
there
got
was
a new
dust
longboard
storm.
too, so
It
that's
looks
cool.
like there was a dust storm last Saturday. We went out driving and it was crazy. So there was dust storm. I'm glad you got to get away too, but I did respond to your email for a reason. Okay. Why? Why did you forget what was assigned to you? Because you went out. Where's that paper? So how are you going to present
I-
today,
I
Caps?
wr-
Robert.
Yeah, I finished it. I wrote it down on a piece of paper. I just couldn't find it.
Maybe I should go back to a recording and see what was assigned to you. Anyway, Ziri, how are you? You look so fresh.
I'm really good.
You're good?
I'm off today, so I'm just like.
You're hiding because you're not in your scrubs.
No, I am.
Are you? Okay, I thought you weren't in your scrubs.
No, I am.
Okay.
I got off work early on Saturday, which is rare because I usually work closing shift. So I had the whole day on Saturday. And then I just went out to eat with my siblings, my cousin, and my boyfriend. And then yesterday I went out to breakfast with my parents and my siblings, which was nice to spend time with them.
Really good. Yeah, it's always nice to spend time with your siblings. I miss my sisters too. We have a really loud chat group. So I turn off notification. I'll only check whenever I can. Okay, good to hear. What about you, Jess? Did you get to recover over that weekend or did you work?
I went to work, but then I got sent home.
Oh, because
yeah, the same reasons. So I didn't really do much over the weekend. I just kind of stayed home. I went to the park to get like some fresh air, but that was about it.
Yeah. And it said there was no sun. I mean, not much sun the last couple of days. Makes me sad when there's no sun. The sun is like an antidepressant. Okay. That's where you could get your vitamin D as well. Okay. What about you, Nicole? Now I know that you don't like cheese. So when we eat together, I'd be happy to take all the cheese from you.
Go ahead.
Okay.
Disgust me.
Okay. Did you work this weekend?
Yes, and I hurt my fingers working this weekend in the stupidest way possible too.
Is it a restaurant again?
Yeah, the restaurant's open now. So it was busy yesterday and the day before that. And there was so many customers and I had to plate so many plates and I kept putting the weight of the plates on two specific fingers. So those fingers started to swell and they hurt to move now.
You kind of sandwich your fingers between two plates. Was that what happened?
No, so like, hold on. I had
She's gonna demonstrate. I love
like
it.
this.
Oh.
Yeah, and it wasn't good for my fingers, but I mean, they're gonna get better because I have today off. So if they don't get better today, I'll cry just a little.
Yeah. Cold, maybe cold ice compress and then warm after. Okay. I want to get your concession because I haven't put out lab schedule. Friday's a constant. Remember I told you Friday's going to be a constant. Miss Trisha will be at the campus from 9 till 3. Okay. Who can make it on Friday? And that's for our IV. That's for our IV. Still, Robert, Cav, Tony, Eileen this Friday, yes? Okay. I'd like to open the Thursday too. Because Thursday you don't go live with me. Okay. Who wants or can do Thursday as well? And that will be I gotta double check with Miss Trisha what because she wants Mondays, Wednesdays, and Fridays. So I wanted to do the Thursday shorter. The Thursday can be 9 till 12. So who can? The Thursday is I'm just waiting on your concession, okay, right now, okay? You're not going live with me, but 9 to 12. Who wants to go to the campus 9 to 12 on Thursday for extra labs? So Eileen, because Eileen needs it. That's why I'm trying to open as many labs too. But to those of you, you're still on track. If you keep coming on Friday for the IV, you're not going to be delayed. Okay. How was your Friday class with Miss Trisha? Isn't it fun? Learned a lot. The demos. Yeah. Okay. She's back. It's just tough for her to really be moving, but she can with your hands. Yeah. That's why I said we don't We don't do BS. We don't have any excuses. You'll probably see me and Miss Trisha so injured and still at the campus working. Okay. So Kevin, how'd you like the lab last Friday with Miss Trisha?
It was very fun. It really reminded me of kind of like how we used to do things on the sterilization surgical side. You know, everything has to be in a certain order when you're donning your PPE, how you wash your hands, you know, and then, you know, maintaining sterility and not cross-contaminating or anything like that. So it's a nice refresher. And then I also like, you know, like when we were doing the reconstitution and doing everything with the needles, because I haven't done that in years, you know, dealing with needles. So it's nice to do that all over again as well.
Yeah, that's really good. Okay. And then more practice like that, it'll get you more comfortable. Okay. That 20 hours will go by fast. So if you're there 9 to 3, but you're with me on Friday, so it's only 1 to 3, that's 2 hours. It's only 10 days, 20-hour practice. At the beginning, of course, Mr. Shaw will do demo, and then you're going to be on your own. You have to watch first and then do it on your own, right? And then the more you come to the lab, if you do it twice a week, even more so. Okay, that's why we're trying to open as much. Remember, you're going to have labs again for certain classes. This is not the only labs you're going to have, okay? And also what we're teaching you is the latest USP 797 standards. Okay, so the classes on Udemy, okay, will be updated based on the USP 797 current standards. There were some modifications like the double garbing. Ms. Trisha mentioned that to you, right? Everything double garb. And why? Why is that? Okay, I'm not going to deal with that right now. Okay, what about you, Robert? Did you make it to the campus Friday before you hit the road?
I sure did.
Good job. So how was it for you? The demo?
It was good.
It was really good. Okay, good. What about you, Tony? Did you like it?
I did too. It's new. It's a little scary because it's you have to sort of be technically pretty good on everything, and there's a lot of things that you technically have to do. But it's nice, and I think once we get better at it, it'll be even more. It'll be fun.
Yeah. Don't get overwhelmed. Remember, at the beginning, the first few hours, you'll be shaky, you'll be nervous, you'll be scared. That's why there's practice. Practice makes perfect. Okay. I know I can see the face on Jess's. I can see Jess's face, just like, oh my gosh, it's a bummer. I made arrangements to go there, and then they got to do that. Don't worry, Jess. Okay, you're just a freshman, so we can get caught up in the. We can get caught up on that one. I know, because she tried to make it work, but then she had. Yeah, you're not going to be allowed entry. But please don't lie. When you feel sick. I wanted to go to the campus today, but my throat hurts. Though I haven't been in contact with anyone the last 2 weeks, my throat still hurts. So I really wouldn't lie about that, okay? So let's start off with our Monday motivation.
What I do know is this. Every single person watching or listening to this has immense power inside, has incredible talents and gifts, has incredible capabilities that they don't even know exist right now.
So many people have written discount version of yourself, okay? But you have to, again, think to yourself, okay, I am left, but I can now turn this left into something positive. What's important is for people to understand that setback, forsaken, rejected, it didn't work. That setback is only temporary.
There's an element of just getting back up again when you've been punched so many times that you feel like you can't. And
there are times you feel like you will never get out, and that you will be a discount version of yourself, and that what used to be your life is not going to be your life. And that is not the truth.
You can do anything you set your mind to if you roll up your sleeves, you get in there and you do it. Everything is figure outable.
The only real power we have in the world is choosing our response. We can't choose what happens to us. We can get stuck into situations where we are not treated fairly, where any number of bad things can happen. And so the only choice we can make is how to respond. And I find that that knowledge gives me so much freedom, because if something bad is happening to me that I can say is beyond my control, I can say, well, at least, you know, I have the power in my response to show the world what kind of person I am.
In the moment, we have to work with what we have, like to just alchemize the anger, the frustration, someone putting you down, and to use it as a positive and productive vehicle to help you move ahead.
The key is not to try to become the person you used to be. And you may have heard this saying that I say, a comeback is not a go back.
So I win or I learn, but I never lose. What does that mean? It means that no matter what situation I put myself in, either I'm going to be a baller and I'm going to knock it out of the park, or I'm going to learn a ton. And then I'll be like, okay, so I learned all this stuff, I could do it next time, but I never lose. So I'm not attaching that identity. Does that mean that I never make silly mistakes? Of course I do. Does that mean in the moment when I've wasted cash, when I've made a poor judgment call, when I've fallen flat on my face, that I don't freaking cry or feel like an idiot or absolutely want to cry in the corner? I absolutely do those things. I do those things. But then the moment I like actually take a breath and have a little perspective for a moment, I'm like, okay, I win or I learn, but I never lose. And that allows me to get back up, contextualize it, and keep on trucking. All we're striving for, progress, not perfection. And I think that those stumbles and those screw ups are a really positive indicator that you're actually in the game, that you're actually making progress, and that you're on your way eventually to victory.
Best piece of advice I ever heard is don't punk out and quit. Worthwhile, worthy things in life are just the result of a lot of, painful, enduring failure. Like you'll be annoyed about, I often get annoyed about something somebody said to me at the office, or some political thing that's going on, in my friend group, or some other issue. I'm stuck in traffic and I will forget, wait a minute, okay, at the end of the day, I come from stardust. I will return to being stardust. None of this matters at all. The only real thing that matters is love, loving people and being loved yourself. And I think everything else is kind of gravy. So
go find something that you're so friggin' passionate about that you can't help yourself, but just attack it, and then just go and start having fun with making your life immeasurably better.
I always show you the credits because I want to give credit where credit is due, okay? I like impact theory. I like Tom Bilyeu, okay? He's a guy who always has this like poster board with quotes for the day. And I like everything that he always is like 3-step or whatever this is. But the reason I wanted to show you this, okay, not only because it's Motivation Monday, it's because it's so true. Sometimes people don't like that you're very competitive, okay? Like you gotta lose sometimes, okay? But to me, like what she said, okay, of course everybody likes winning, right? But to me, even if I lose, okay, because it was a failed project, it was a failed business, okay, that's still not considered a loss for me, because in that process, during that journey, during that process, I learned something, or I learned a lot of things, or I met a lot of people that became my friends, that contributed to who I am. So that's still a win. That's why I consider I never lose. Okay? That's one thing that's very important for me to understand and explain to some people, that it's not just you being competitive, you gotta lose sometimes, right? Yeah, it's true, you gotta lose sometimes. But my perspective of losing and winning is different than yours. In my head, I still won, even if I lost, right? Have you seen this picture of like 3 kids, first place, second place, third place, and then the first place is right here at the middle. The second place is right here, and the third place is right here. Yeah, and the third placer had like the winning smile and attitude, and the first placer is just like normal win. So it's his attitude that made him a winner. The third placer, right? It was normal for that one at the middle who got the first place, but he's the true winner. Because even if you only got third, that face, that smile, I wish I could find it for you. Okay, quick takeaway, Nicole. Which part of the, it's just 5 minutes and I love it. Okay, which part of that video you like?
I like
that hit you.
I like the part where they said that they win and let me think.
Go ahead.
They win and learn, but they never lose. I really like that part and how they always constantly get back up.
True. Okay, Tony.
I agree. That's a pretty good, and I think people probably need to learn to train their minds to think that way, because you can just say it to yourself, but I think you have to like put it into your mind that instead of just saying it like, oh, this is how I'm gonna think. That's something people probably have to learn.
Good. Kev.
I like the part where she was mentioning about like love, like, you know, loving each other, loving other people, loving what you do every day. You know, it's important that we have that mentality that we love, you know, one another, because there's a lot of stuff going on in the world right now, a lot of negativity, a lot of hate, a lot of violence, and it's always important that we also take that away, you know, and we, you know, we love each other, we help each other out, you know, as fellow humans, you know, as fellow people, you know.
Yeah, true. It's so, I think that's what we're lacking right now is so much hate. You're right. So much violence. Like every little thing, there's a hate for that. It's like all this, it's so sad. Jess, just one thing that struck you.
Probably touching up what Kevin said, how she also said to love yourself. I think that people are just too hard on themselves sometimes. And once they fail at something, they kind of give up rather than trying again.
Yeah.
So that kind of hit home.
Yeah, like self-compassion. We're too hard on ourselves sometimes. And then this goes for moms like Eileen and myself. We are so self-sacrificing. We give everything, okay? We have everything. We're so, and then we forget ourselves. We forget to take care of ourselves. That goes for your moms too. And I can relate to that. What about you, Eileen?
Same thing with everybody. Yeah, I like the love-hate part, and where when you lose, you accept it and just get better at it. So yeah, that's what I thought.
Thank you. Ziri, what about you?
I really liked when they said that you have to deal with what you have, because you're not always going to have everything. So you need to work with what you have at the moment.
Very good. Yeah. Oh, I want 5 monitors set up. You don't have money. You don't have money to do that. So make do with your laptop that's 10 years old. Okay. And then make money to buy that 5 setup monitor. Right? Make do with what you have. Yeah, we're so spoiled, especially here in the US. Yeah, we just get everything we want. And then that's why we end up with a lot of things in our house that we don't really need. Robert, save the best for last. They're all agreeing, see?
What? Oh, I just like the part where they kept talking about, you know, bringing themselves back up, because that's the best thing you can do if you get into something that like makes you feel like you lost, you know. Because if you just stay down there, you know, you're just going to be down there the whole time and nothing's going to happen.
Yeah, same with classes. If you fail one class, then retake it. I told you PM is such a good school. They don't even ask you to pay again to retake a class. Try doing that at the state college. You got to pay again, even if you're just refreshing. If you want to sit in my class at the college, you got to pay again. All those fees as well, computers, et cetera, et cetera. Okay. There's one thing we also forgot, which is very important. Okay. You cannot control what's happening to you and how people treat you and react to you. How people treat you, you cannot control that. However, you can control how you respond. You can control how you react. Okay? This person did this to you. Will you scream and yell and do the same thing? Or will you just walk away? This person said these things to you. Will you have a word war with this person? Or you will just stop and walk away? I'm not saying to make that habit of walking away, but come back later on when you're both calm, sit down and discuss the problem. Don't you think that's a smarter way to do it? Yeah, we can never control how people treat us, but we can always control how we react to it. That's one thing that we forgot that's very, very important, okay? That makes you a better person each time, okay? I like our Monday motivation. Let's start. Who's ready to start presenting? That was fast. Kevin did it first. I saw Nicole next, and then Ziri third. Okay, Kevin, take it away.
Alrighty, guys. Good morning. So my drug for this week was phenylephrine. Phenylephrine. So this drug. So when I looked it up, there was, just bear with me, a lot of information.
Wait, Kevin, not pheno, okay? It's phenyl.
Phenylephrine. Okay. Phenylephrine. Okay. So common brands for this are Sudafed for congestion, and then Vasculip. But there is more information that will go on as we go on with the information here that I have to present. There's different types of like routes you can take with it. And I'll get to it. And then I don't know if you guys can see the two images here. So I have the tablet form for the Sudafed, and then the Vasculip, which is the injection that you can give. So what is this used for? It's to treat stuffy nose and sinus problems. If we're talking about the Sudafed. However, it's also to treat hypotension if we're talking about the Vasculip. System, cardiovascular. Therapeutic class is a decongestion vasoconstrictor, and I'll get more into that later. Pharmacological class, it's an alpha-1 agonist. Pregnancy category, so this is another one of these drugs that it's kind of different depending on the subtype of the drug that we're using. So it's B if it's a decongestion with the Sudafed. C if it's used for the hypotension version, which is the Vasculip, during anesthesia mainly. So they're using this Vasculip as during anesthesia because patients, when they're giving the anesthesia, some of them have a higher blood pressure during the procedure. So this is to bring it back down to a regular level. DA class, it's over the counter or prescription only, but it's controlled if it's a Phenergan BC, which is a combination drug that has as the different drugs that are listed here: the codeine, phenylephrine, and then the promethazine. Administration, there's various administration forms. I'll get to a couple here, but these are the main two. Vasculip was an IV solution, and then there's Sudafed, which is oral tablets, and they come in 5 milligrams and 10 milligrams. Some common side effects: we have palpitations, tachycardia, which means an elevated not blood, I'm sorry. your heartbeat is raised and it's going faster. Occipital headaches, which is basically your headaches like towards the front. And then for the Vasculip, some common side effects were anxiety and hypertension. So it could elevate it to beyond normal if given too much. And then in this little asterisk here, I have so basically it has a myriad of uses and variants. For example, the glaucoma one for it's the ophthalmic version. It's a different version or different route for this medication. It's for the eyes. This one is to treat glaucoma, white-eye glaucoma. And then there's another one for nasal. So instead of, dealing with congestion with tablets, you can also do a nasal spray into your nostrils. So that's come up. Oops, let me go back. So that's some of the things. And then some other miscellaneous information that I have. Let me get my notes here. So, okay. Some other forms of the, um, let's see here. So, okay, so phenylephrine, when it's in the combination, that's for the decongestion. Codeine, it's for the antitussive if you're coughing. And then the promethazine is an antihistamine. So all these three here come in conjunction for someone who's like very sick. And obviously the codeine is what makes it a controlled substance. So you can't, you just get this, from over the counter or anything. It has to be prescribed to you. And let's see here. So some other routes or some other versions of this. So there's the PO by mouth, which is the Sudafed here. There's the ophthalmic, there's a nasal, there is suppository versions, there's a topical version of this medication. There's a bunch of different routes that it can be administered through. And this medication cannot be used while you're also using an MAOI because there could be a deadly side effect if you're taking those in conjunction. And of course, you can't do alcohol with the intake of this medication either. It could lead to liver damage. And another thing is too, for Sudafed, you have, when you go up to get it, like let's say if you want to get the over-the-counter version, you still have to present an ID when you get it. And usually they have to make sure that it's limited, how much you're getting, because they could use this drug to make meth essentially. So just keep that in mind. And that's pretty much it.
Okay. So Sudafed, don't take it down yet, okay? Sudafed is a big brand, just like Tylenol is a big brand, okay? Be very careful though when you're grabbing this, because this is over the counter, okay? There's Sudafed PE, which is phenylephrine, okay? Just like there's Tylenol PM, which is a combination of acetaminophen and diphenhydramine. It's like Tylenol and Benadryl. There's a Tylenol for arthritis, Tylenol arthritis. Sudafed is a big brand just like Tylenol. So be very careful. Since we're talking about phenylephrine, if you are to choose a Sudafed brand, that would be your Sudafed PE, okay? So I don't want you mistaking this from phenylephrine and pseudoephedrine, okay? So on your blackboard, I actually put, I think, something that has something to do with what's the difference between phenylephrine and pseudoephedrine. Phenylephrine and pseudoephedrine. You want to check that, okay? One more information that may come up on your national certification exam, PTCE or ExCPT. Okay, hint, hint, wink, wink. You want to put this, if you have that little notebook that I recommended for your board exam, and every time I say hint, hint, wink, wink, put this. Okay, Sudafed or phenylephrine is a decongestant. Okay, in general, okay, decongestants are over the counter. So we got to be very careful with this next information I'm going to say. Kevin said you should not take this with MAO inhibitors, correct? Also, this comes up on the PTCE, very common, okay? Decongestants should be taken with warning, or just don't take it with antihypertensives. Why? Decongestants increase blood pressure, okay? So tell this to your parents, your loved ones, your siblings, if you're taking care of your parents or you yourself. If you are on an antihypertensive or your blood pressure medication, do not take decongestants over the counter. It will shoot up your blood pressure, and that's because of the drug. But remember, this is a reversible side effect. So if you're off of that medication, the blood pressure won't shoot up anymore. Okay, it's not a continuous side effect. Okay, so this is a reversible effect of decongestant, increased blood pressure. Thank you. Good information, Kevin. Next one. Who did I say is next? There you go. Perfect.
We got this. Okay. So my drug was Quinidex. The generic is quinidine sulfates. And then the therapeutic class is anti-malarial. And the pharmacology class is antiarrhythmic agent. The pregnancy class is C, and it's an RX. So you need to get a prescription to go and get it. The side effects include diarrhea, nausea, vomiting, dizziness, and lightheadedness. The use of this is to treat certain types of irregular heartbeat, but it makes your heart more resistant to abnormal activity. The drug, it will help control your condition, but it won't cure it. And then to make sure it's safe, you should you should most likely tell your doctor if you have a heart disease or any heart rhythm disorder, low levels of platelets in your blood, or low potassium levels. Also, if you had or have liver or kidney diseases. To take this, you don't crush it or break it down. You just swallow it with food or with a drink. And then also you should avoid eating grapefruits or drinking any type of grapefruit juice unless the doctor says otherwise, because it could change the amount of certain medications that are in your bloodstream.
Very good information. And she said all of it correct. Quinidex, quinidine. Good job. Okay. Pronounce as you would read it. Okay. Once the brand names are pronounced differently per country, depending on the country that manufactured it, like what I said. But since we're here in the US, pronounce it as Americans would. Okay. So just read it and then pronounce it as you'd read it. Number one, quinidine is an anti-malarial. Okay. What is malaria? It's caused by what? Anyone? Mosquitoes. Okay? So it's not very common here. However, in other countries, it's still very common. Okay, that's primary. That's the primary use. When quinidine was discovered, it was for malaria. However, look at the pharmacological class, which is actually a therapeutic class as well. Anti-arrhythmic agent. Arrhythmia, irregular heart rate. Okay, let's do a quiz. Tony, what's fast heartbeat?
Tachycardia.
Tachy. What's slow, Kevin?
Bradycardia.
Bradycardia. Okay, so this drug is used to treat that irregular heart rate or irregular heartbeat. Okay, so primarily an anti-malarial, but right now, okay, with another use, which is anti-arrhythmic. It regulates that irregular heartbeat. Okay, very good. Nicole mentioned to not take it with grapefruit juice or grapefruit. A lot of these drugs, okay, even your statins, okay, should not be taken with grapefruit or grapefruit juice because the absorption will change, the metabolism will change, okay? So those are the things that should be remembered or with warning, okay? What do you need to remember? Drug-to-drug interaction, the side effects, okay? Remember, side effects are expected because based on clinical trials, they've seen that, right, happen. But adverse reactions are not on the typical range of side effects. That's why we report that, okay, just like the vaccines that we have right now. Thank you. Good job, Nicole. Next one. Good job, Kevin, too, if I didn't say good job a while ago. Thank you. Before you start, get ready. Next would be Eileen, Tony, Robert, then Jess. Okay, Jess, let's try yours before I put mine in so that you can fix your setting.
Okay, so I got nifedipine. That's the generic name. The brand name is Procardia. Its pharmacology class is CCB, which is calcium channel blockers. Its usage is for chest pain and high blood pressure. The DEA class, it's not controlled, it's prescription only. The pregnancy class is C. Some side effects is dizziness, weakness, swelling in the ankles and feet, constipation, and or headache. So this drug, it lowers the blood pressure by relaxing the muscles in your heart. That way it doesn't pump as hard. And then it was FDA approved on December 31st, 1981.
Please leave that for now. Okay. The generic is nifedipine. She said it right. So the brand is Procardia. Okay. I'd like you to start picking. Okay. Calcium channel blocker, CCB, for angina and hypertension. Okay. We're studying a lot of drugs. Nicole got kicked out, I think. We're studying a lot of drugs. She moved. Let me help her reconnect. We're studying a lot of drugs right now that are under the cardiovascular system, respiratory system, and digestive system. Okay. When I was back in pharmacy school, we didn't have all these apps or gadgets or tools. We only had flashcards, index cards. I'm thinking of the right index cards. Okay. At the beginning, it was just white index cards, and then one of the best creations in the world happened, which is colored index cards. After Post-its, like Post-its used to be just yellow, now it's colored Post-its, right? So this is what I did. And I think some of you heard me say this because it was just flashcards for us before. I bought different color flashcards and I color coded my drugs. Okay. And this is a secret. My pharmacology professor isn't a really good teacher. So we really struggled a lot, okay, in pharmacology. So we had to find other references. We had to be creative in studying pharmacology, okay? So she was the assistant dean of the pharmacy school. But anyway, so we found this book called Pharmacology Made Ridiculously Simple. And it has drawings like cartoons, and that's how we understood pharmacology. From this thick book, one of our friends found this book at a small bookstore, just this thin. When we got there, they said the book comes from the US, so we waited months until the book came in. Okay. Anyway, going back to the index cards or flashcards, this is what I did. I color coded it. Drugs for the heart. There's no red index card. Is there a red index card right now? Pink, right? Pink. Okay, so I put all my drugs in a pink flashcard. Okay, pink. Every single drugs for the heart is on a pink flashcard. Why? That's close to the heart. There's no red, so pink is the closest, right? Okay, and then my anti-infectives. What am I thinking? Antibiotics, drugs for infection, antivirals. I put it in the neon green or neon yellow. You know what I'm talking about? The bright green or the bright yellow. Why? What was I thinking when I color coded it that way? Infection pus? They're like yellowish, greenish, right? So I did it that way. Okay. Now, each flashcard, one drug, each flashcard, one drug, right? So you color code it based on how you want it. There are other colors. Okay. During the test, you know what happens to me when I'm taking tests? I can actually tell the therapeutic class because the color of the flashcard is flashing in my head during the test. This is a drug for the heart because I wrote it in the pink card. This is either an antibiotic, antiviral, or antifungal because I put it in the bright yellow or bright green card. You know, the drug sometimes don't flash in my head, but the color of the flashcard flashes in my head. You see what I'm saying? Okay, 80% of the entire population of the world are visuals. What do I mean by that? You gotta see to believe. You gotta see what happened, yeah? So that you believe it, okay? And you don't believe until you see it, okay? I remember I went to Beijing, China, and because I was bringing drugs legally, of course, not just bringing drugs to other countries. Yeah, that was part of my job. I go to conventions, I attend conventions in the past, and I would look at breakthrough products or very interesting products that I can bring to the country. And there was this burn cream or burn ointment. Okay, burn cream or burn ointment. And like what I said, 80% of people are visuals. They got to see to believe. Okay, so people wouldn't believe that it works until they see it. This is crazy. Brace yourself. This guy put a tube, not a tube, a pipe, a metal pipe right on the flame. Okay, heated up the pipe and held it like this. So we smelled burning skin. Okay. And then it was traumatizing for me to see that because my mom had breast cancer and she'd come home smelling like burnt skin from radiation therapy in the past. Okay. And my mom was already gone when I had this job. So he put that hot, really hot pipe on his hand and held it like this. Okay. And then put a thick cream or ointment. Okay. And then let it stay there for 5 minutes. He scraped off the ointment as if nothing happened, but he's still in pain. You can see his face that he's still in pain, but you can see that it didn't burn this because he put that burn cream right away. Okay. So what do you think happened after that? Westerners actually have to really see before they believe. That's one thing I've noticed, okay? All of these Westerners fell in line, okay, including myself, to buy that particular product. Why? Because I saw it right in my very eyes that it worked as a burn cream, burn ointment, okay? I saw the guy walking still in pain, though he didn't have that scar. Okay, because burning can go different layers. It went as deep as, I don't know how deep, that's a metal pipe. And he held it. Okay, we got to see to believe. I actually still have one jar of that burn ointment from Beijing. I'm actually going to grab it while one of you presents. I put it in the refrigerator. Okay, and it still works. Yeah, so if you're cooking or you got burnt, you put it right away, it works like that. But if you wait, of course, your skin is going to get burnt, okay? And that's what I'm saying with the flashcards. And that's what it does, okay? We see when we review for our drugs, pink, oh, I know now. Even if we can't remember the drug itself, you kind of figure out what that is, okay? I'm just giving you study tips, okay? Good job at Ziri. Next one.
All right. So my drug is Orlistat. The brand name is Ally. or Senecal. Drug class is peripherally acting anti-obesity agent. DEA is RX, and they have it over the counter. It's not controlled. Pregnancy category is X. Dosage, they have capsule, and they use it to aid in weight loss or to help reduce the risk of regaining weight already lost. And this is also what it does. It blocks some of the fat that you eat, keeping it from being absorbed by the body. And orlistat is used only in adults that are overweight or obese. And for the cynical part, um, oh, wait, okay, so warning says do not take orlistat if you're pregnant. Um, and you should not use this medicine if you have a digestive disorder problem absorbing food. You should not use cynical if you have gallbladder problems or if you are pregnant. Do not use ally if you have had an organ transplant or if you use cyclosporin or if you are not overweight.
You done, Eileen? You're still
Yes.
going?
No, yeah, that's it.
Okay, so orlistat is a generic. It's not a stat. It's not a statin. Okay. The first brand was Senecal. Senecal. Okay. How do you say it? Ali? How do you say it? Ally or Ali, the brand?
It's ally.
Ally, okay. But the first brand that was introduced was Xenical, okay. I knew that this was the first brand because one of my friends is the pharmaceutical rep for this particular brand, Xenical, okay. And I don't want you to confuse this with statins. This is not a statin, okay. The generic is Orlistat. The brand name is Xenical or Ally. Ali. I really don't know how to pronounce it, the brand. Anyway, because some say Ally, some say Ali, okay? Going back, I said one of my friends, a pharmaceutical rep, handled this drug, okay? And he said, you have to carry with you extra underwear, okay? Or you have to use diaper when on this medication. Okay, why? Let me tell you how this works. Okay, it was popularized, I'd say early 2000, okay, as a weight loss drug. Okay, so we Filipinos and I think other cultures similar to ours love to eat and love parties and fiestas, right? I think everybody does. Okay. And we got greasy food. That's my bottom line, more than the parties. Okay. Our food is greasy. Filipino food is greasy. Okay. Jess is nodding. Hey, think about adobo. All of this. So great. And everybody loves adobo. Number one food Filipinos have, adobo, very greasy. Okay. So we kind of cheat our way. How do we cheat our way? Well, this wasn't prescription in the, when it was introduced. We'd take, or some people, I didn't do it because I was scared of the side effect I'm going to tell you, okay? Take that capsule and whatever greasy food you eat will just go out. So the fat won't stay. Crazy, right? Okay. We also have a dish called crispy pata. Oh my God, Kevin's like, because he had a kuya back in San Diego. Kevin, can you describe, Kevin's not even Filipino. What is crispy pata? It seems like you like crispy pata.
So yeah, it's the pork leg, but deep fried, basically. Yeah.
Yeah, so it's actually pork thighs.
Yeah, pork thighs, and he made them. Well, we called her our tita because she was like our coworker and she would always cook for us. She brought them in and it was just, it's just really greasy, really delicious. I don't know what to say. with a little bit of vinegar, it goes well too.
Yeah, soy sauce and
Yeah.
vinegar. Very good. Yeah. Also lechon, which is the roast pork. Okay, so greasy. So we would cheat our way by taking that, and then whatever fatty food you eat, you just eliminate it. Here's the problem though. It passes fast. That's why you're actually gonna see oily, greasy feces. Okay, and here's the problem. It works so fast that after you eat, just probably within an hour, my student termed it, this is not a medical term, but he called it anal leakage. It's not a medical term, okay? So the side effect is that, so it is uncomfortable because you cannot control it. It's just gonna come out as an oily, greasy leak. That's why my friend said when he used to handle this, you have to have either sanitary pads, extra underwear, or you should be on diapers, okay? But it works. What happens is the fat doesn't stay in your body, okay? You eliminate it fast. So I'd say you take the bad with the good, okay? You want to eat that stuff, you don't want it to stay in your body, well, there's a drug for that, but that's the side effect, okay? I don't want that embarrassment, so it's either just don't eat the greasy food or just eat in moderation, yeah? So a lot of my students like this drug because of that story that I told them, and they'll never forget, okay? So Orlistat is a generic. It's not a statin, remember? Popular brand names are Senecal and Ali, okay? Any questions? Thank you, Eileen. Who's next? Who's next? I don't see a slide. I think it's Robert.
Oh, okay. I thought, all right.
Do you or do you not have a PowerPoint?
I have it.
Okay. By the way, this is the, while we're waiting for Robert, this is the burn ointment that I was talking about. Yeah, right here. Because I don't know how to cook. It's handy. It's in the refrigerator. So it works. Okay, so it's like a white ointment feel, but more creamy. You will be making ointments, creams, lotions in non-sterile compounding, during non-sterile compounding. Okay, very good. So Robert, how'd you figure out which one is your drug? When you got home, you found your paper?
Well, since I wasn't getting a response, I asked Kevin and Tony, and they told me.
What would you do without Kevin and Tony, right?
Right.
Yeah.
Anyways, my drug's Proventil. The generic is albuterol. The therapeutic is a bronchodilator. The pharmacological is a beta-2 agonist. Pregnancy category C, DEA class is RX. Some adverse effects that you can happen from it is tremors and nausea. It comes with the inhaler, but it could also come in tablets. And it's used to treat bronchospasms, and it relaxes muscles and airways and increases airflow to lungs. So it would be helped and used for asthma. And for the inhaler, you would have to use it like every 4 to 6 hours or whatever the doctor or prescriber tells you what to do. And if you're going to plan on exercising, you have to take it 15 to 30 minutes before you exercise so you don't have any breathing problems. And when you're using the inhaler, you have to shake it every time you use it. And I think it said like you have to use 2 inhales. So you would have to shake it, inhale it, then shake it again and inhale it. And this would usually be used for, I think, kids that are at least 4 years old or adults.
A couple of things. Good job, Robert, on the brand and the generic pronunciation. Proventil, albuterol. Okay, bronchodilator. We've studied respiratory and cardiovascular system, right? Broncho, okay, pertains to the lungs, the bronchus, the bronchioles, dilator. So that's why I keep telling you the therapeutic class is actually a medical terminology for you to know what the drug does or the use of the drug. Okay, this is one of those metered dose inhalers, MDIs. Metered dose inhalers are what? When you spray, it's actually pre-measured. Okay, one of the things that you want to remember is to shake before using, okay, because it might be too concentrated or less concentrated. You're not getting the active ingredient, you're just getting the inactive ingredient. So shake and then press, inhale. So we say puff. The term that we use is puff. Okay, 1 puff, 2 puffs. Okay, another thing, it may be hard for kids to use this. So we do have adapters, okay? Because it's hard for kids to multitask, press, and then inhale at the same time. Another common thing that comes up on the PTCE or National Certification Exams is the calculation of this. 200 metered inhalations. Can you see that? Okay. It can be a simple math question. Like if this is 200 metered inhalations, that means 200 sprays or 200 puffs. Okay, and then here comes the day supply play or the quantity to be dispensed play. Let's put this in action. Okay, say for example, this Proventil, as the label says, is 200 metered inhalations. The sig of the doctor is to take 2 puffs every day. Okay, how long will this prescription last, or how long will this inhaler last?
100 days.
100 days. Okay, that can be a question on the PTCE. Okay, so metered inhalations is 200 sprays or puffs. So if you see on the sig, take 2 puffs, then 200 divided by 2 is 100. It will last 100 days. You follow? Okay, good. Thank you. Next one. Last one. Are you the last, Tony?
Possibly.
I think so. Oh no, Jess. Jess will be last, and then I'll go over the others.
Okay, how's that? Can everybody see my screen? All right, can everybody see my screen? Okay, perfect. My drug is Provocol. The generic name is Pravastatin. The therapeutic class is a low lipid lowering agent. The pharmacological class is HMG CoA reductase inhibitor. The DEA class is prescription only. For the pregnancy class, I found X only, so it's X. It's used to treat high cholesterol, to lower the blood levels of bad cholesterol, which is LDL, to increase the levels of good cholesterol, which are HDL. And it can be used with other medications. The dosage forms is by mouth, and it comes in 20, 40, and 80 milligram tablets. The adverse effects are muscle or joint pain, nausea, vomiting. Oh, and I don't know, I had the pregnancy class twice. And a few of the things I found were the patient should be placed on a standard cholesterol lowering diet before receiving this medication, because it's not just the medication that you have to change the way you eat to help the medication.
Are you done, Tony?
Yes, ma'am.
Okay, so this one is a statin, pravastatin, and statins are for cholesterol, lipid lowering. So look, therapeutic class, lipid lowering agents. Another terminology, anti-hyperlipidemic. Anti is against, hyper is high or increased. Lipid pertains to cholesterol, emia in the blood. Okay, emic makes it the drug. Okay, and pravastatin, statins, pharmacological class. This should ring a bell. HMG coenzyme A reductase inhibitor. You should have a going list of anti-hyperlipidemics, statins, HMG coenzyme A reductase inhibitors right now, because we've gone through a good number of them. Okay, and this is what I'm saying. If you put that in a colored flashcard together, once you're taking the test, that color is going to be flashing in your head. Oh, I put it in the, what are the colors of the flashcard outside of the green and the pink that I mentioned? On the yellow.
Yellow.
White. Maybe you put that into white. Okay, flashcard. Pregnancy category X for pravastatin or Pravachol, meaning do not give to pregnant women. Let's recap. I'll quiz you again. Which one is good cholesterol, HDL or LDL? Nicole, can you hear me? Which one's good cholesterol, HDL or LDL?
HDL.
HDL. For this one, we want the high. Yeah. Yeah, it's the opposite. Usually we want low of everything, right? To be healthy. But for the, if you're to be asked, which one is the good cholesterol, HDL or LDL? It's the high density lipoprotein. That's the good cholesterol. Okay, and the low density lipoprotein is the bad cholesterol. I also mentioned this in my audio lectures, just so you know, okay? It's in your lecture packet too. Thank you, Tony. Jess, let's try yours. If not, I'll go download the one you emailed me, or I'll download it now just in case. Oh, yay! Good job. Okay, you got it. We're seeing it. Good job. Unmute yourself. We couldn't hear you.
Can you hear me now? So my medicine was Crestrin, and that is actually the brand. The generic is cholestyramine, and therapeutic class is anti-hyperlipidemic. pharmacologic class bile acid sequestrant, used to lower high levels of cholesterol in the blood, especially low density lipoprotein, which is bad cholesterol. Also used to treat itching caused by a blockage in the bile ducts of the gallbladder. The DEA would be prescription only. Pregnancy category is C. And additional info, it is a powder. So when you take the medication, you have to mix it with at least 2 to 3 ounces of water or a non-carbonated beverage. You can also mix it with food such as like soup or applesauce. This medicine should be taken within 1 hour after or 4 hours before other medications. It can affect the surfaces of your teeth. So when you sip the mixture slowly, or if you're holding it too long in your mouth, it can cause tooth discoloration, enamel erosion, or tooth decay. So it advises to brush your teeth regularly when you're using this medication, and drink extra fluids to prevent constipation, and store at a room temperature away from heat and moisture. And that's all I got.
Very good. Okay, question is a brand called Styramine, is a generic therapeutic class, is also anti-hyperlipidemic. However, this is not an HMG coenzyme A inhibitor because statins are the HMG coenzyme A inhibitor. Can you follow? Okay, so what does it do? It lowers high levels of cholesterol as well, just to make it simple, okay? Pregnancy category C. Okay, question is a brand, generic is called Styramine. It is a bile acid sequestrant. So the bile acid is eliminated, okay, excreted. Okay. Again, HDL, high density lipoprotein, is your good cholesterol, and that's what we want a lot of in our body. Low density lipoprotein is our bad cholesterol, and when we go for blood work, we want that to be what? Low. Okay, thanks, Jess. Very good. Okay, I will not show you a PowerPoint. However, I'd like to show you 2 different ways on how you could group your drugs too, so that I give you extra tips. I always give you extra tips, right? Okay, for the test and for organizing your drug words. It can be in a Word file or an Excel file, or in my case, I like using Google Docs and Google Sheets. Why? Because I can save my information and share it to you guys or to whoever needs it or wants it. Here we go. Can you see my screen? First one, I use Google Docs. Okay, sequence 2, week 4. And here's how I organized it. Brand, generic, class, use. See that? Okay. And then I can also use a spreadsheet, which let me expand. Can you see, guys, my spreadsheet too? Okay. So here's my spreadsheet. Week 1, week 2, week 3, week 4. And then week 5. I like using spreadsheets. Why? You can filter spreadsheets just like you can filter an Excel file, or you can filter, what else? What else can you filter? An Excel file or a Google Sheets file. What do I mean by that? So you can filter it. You have to create a filter, and then you create, say, for example, bronchodilators. And if you click bronchodilators, it will only show you all bronchodilators. That's why I like using Excel or spreadsheets, okay? You can create your filters, okay? Here's another way to organize your drugs. Week 1, here we go. Generic, class, use or system, drug interactions. You see, I put drug interactions, meaning do not take with. Okay, and then extra info, it's C4, no to pregnant, similar to amphetamine. You see that? Okay, right there. Okay, so let's continue with week 4, things that I haven't covered or you haven't covered. Okay, Nexium. Okay, Nexium is a brand. The generic is esomeprazole. Let me go here. Might be easier. Nexium is a brand. Generic is esomeprazole. Prazole are PPIs. And PPIs are for GERD. You see how it is? How it becomes easier? Nexium, esomeprazole. Prazoles are PPIs. PPIs are for GERD. PPI stands for proton pump inhibitor. So used for GERD. GERD stands for gastro, which is stomach, esophageal, which is esophagus, reflux, which is regurgitation, disease. Okay, so the contents of your stomach is coming back out into your mouth. That's why you'll hear people say, I throw up in my mouth. Okay, so GERD. In the past, we only have Nexium. We don't have a generic equivalent. But the last 3 years, we actually came up with a generic now in the market is available, okay, which is esomeprazole. Okay. At the beginning, insurance companies cover Nexium because they were introducing the brand. Remember? Introducing the brand. And then later on, they didn't include Nexium in many of the formularies. So say, for example, Kevin has an insurance, let's just say Blue Cross Blue Shield. Tony has Health Plan of Nevada. Kevin has GERD, was prescribed Nexium. Tony has GERD, was prescribed Nexium. Kevin might have Blue Cross Blue Shield include Nexium in the formulary, so Kevin's copay is low to nothing, okay? But Tony goes, Health Plan of Nevada may not have included Nexium in their formulary, so as a brand, so Tony will have to pay the what? Will have to pay the brand copay. Or remember the meme or the picture I showed you? Esomeprazole and Soprazole. What do you do? Or what do you tell the pharmacist if you're the patient? I cannot afford this. Can you ask my doctor to issue another PPI or prescribe another PPI? Then that's when you will be changed to what? Either
generic.
Now we have a generic for esomeprazole, but when I was talking about the first case, when it didn't have the generic esomeprazole yet. So we asked the pharmacist to call our doctor to what?
An equivalent?
An equivalent, not necessarily an exact equivalent, but it can be a lansoprazole. Okay, remember that was your, I think lansoprazole was at series last week, right? So another thing, patents are good for how long? Do you remember, Eileen? Patents are good for how long? Common question on the board exam. Patents are good for?
20 years.
20 years, correct. Okay, you agree, Eileen? Yes, 20 years. So after 20 years, the original manufacturer of the drug will lose exclusivity rights. So other companies can create a generic esomeprazole, okay? Which we now have, esomeprazole. I think the last 3 years we've had esomeprazole as a generic, okay? What else wasn't there? Nitroglycerin. Nitroglycerin, abbreviation for nitroglycerin is capital N, capital T, capital G. Okay, take note, nitroglycerin doesn't have an E at the end, right here, okay? Can you see my screen? Okay, if the brand name is nitrostat, that is the sublingual version of it, okay? Used to prevent attacks of chest pain or angina. Okay, some of the things you want to remember about nitroglycerin, take note, okay? This always comes up on the board exam, national certification exam, okay? Must be in an amber colored bottle, like brown bottle. Protected from air, light, and temperature. That's why we don't put it in the bathroom. It should always have a cotton ball or that adsorbent pouch. So it's protected from air, light, and temperature. Okay. Number 3, it should be discarded after 6 months, whether you only touch 1 or or 3 or half of it, okay? Because by the 6-month mark, it's changed its composition and we are assuming that it's been affected by air, light, and temperature. So after 6 months, discard, or after 6 months, get another prescription, okay? How do you take nitroglycerin? Do you remember? Take 1, place under the tongue. Take 1 when you're experiencing chest pain or angina. Place under the tongue. And then what do? What's the maximum you can take? I mentioned this. Eileen, do you remember? Place 1 under the tongue. Wait how long? You remember? I mentioned this last time.
30 minutes.
I mentioned this last time. Because this is an emergency situation. You want to know.
15 minutes.
How many can you take maximum? How many can you take maximum before you call 911?
3.
Maximum is 3, correct? So what's the intervals? I mentioned this.
15 minutes.
Okay, here we go. Let me show you exactly. So you're experiencing chest pain, or the patient is experiencing chest pain, right? Okay. These are tiny tablets that you place under the tongue if we're talking about nitrostat, sublingual, okay? This may be used prophylactically 5 to 10 minutes prior engaging in activities that might precipitate an acute attack. However, okay, when it's actually happening, the chest pain or the angina, okay, place 1 under the tongue and then wait. Who says 15? Who says 10? You gotta remember to this, especially when I say this usually comes out. What? When do you call 911? Right away? Okay, chest pain, angina. I'm experiencing chest pain, angina. I have a nitroglycerin, right? Okay, place 1 under the tongue because it usually takes effect within, sublingual tablets usually takes effect within 12 minutes. So wait 5 to 15 minutes. Okay, usually I say 15 minutes. Place another 1 under the tongue if the chest pain didn't go away. And then wait 5 to 15 minutes, I'd say 15 minutes, then go away again, place another 1, maximum 3. After 15 minutes of placing that third one, the chest pain didn't go away, call 911. Okay, another thing, nitroglycerin is not put in a child-proof cap. Not in a child-proof cap. It's one, this is another question that usually comes up on the PTCE. It's one of those exemptions, okay, in the Child-Proof Cap Law, okay, the Poison Prevention and Control Act, okay, because almost all drugs must be in a child-proof container unless otherwise specified or requested by the patient, or, okay, it's in the exemption, okay. Oral contraceptives are an exemption because they're numbered, right? Okay, exemption. Nitroglycerin is one of the exemptions in the child-proof cap. Why? You want to be able to open it fast. You're having a possible heart attack. Yeah? So you don't want your patient to die because you transferred your nitroglycerin into a child-proof cap. Okay, so it's part of the exemptions in the Poison Prevention Act or the child-proof cap. Let's go back. Can you see my screen? Not yet. Okay, here we go. We did Ali, we did Sudafed PE, which is the phenylephrine part. We did Pravachol, prednisone. Prednisone, we've covered this. Remember on your prescription? What do you need to remember? It's a corticosteroid. It ends in "sone." It ends in "sone." And what's an important information about steroids? Steroids are anti-inflammatory. Okay. What about the dosing? How do we dose? Remember that? That's why that prescription was confusing on your test. Kevin, do you remember that particular question on the test about prednisone? What was the sig? How was it dosed? Is it tapered up or tapered down?
I don't recall, ma'am.
Yeah, there was a question on your pharmacy tech duties test. You calculate the, I think day supply. Yeah. Was it increasing or decreasing? Taper up or taper down?
You taper down.
You remember, Tony? So at the beginning, it was 3 times, and then it became 2 times, and then it became once, and then stop. Wasn't that the prescription? So you have to remember that, okay? Prednisone is tapered down, just like your antihypertensives. If for 1 year you've controlled your high blood pressure and you want to be off of the antihypertensives, what do? You request the doctor, okay, to say that I've controlled my blood pressure. Usually doesn't happen because we're stubborn. We don't do the diet and the exercise. And the doctor will not take that blood pressure medication off of your prescription right away. The doctor will have to taper down. Same with prednisone. Taper down first before stopping. Okay? Taper down first before stopping. It's used to treat allergic disorders, skin conditions, ulcerative colitis, lupus, psoriasis, and some breathing disorders. Okay. Did I miss anything? Psyllium. Okay. The way I'd remember psyllium is the generic, silent P, Syllium. I always look at the L as like squiggly letter L's because it's fiber. Yeah. So when I'm picturing psyllium, the word, I picture it with the 2 L's as fiber. Okay. Fiber All is a popular brand name. It is a laxative. And what are laxatives? When you're constipated, okay, you may use laxative so that you can actually defecate whatever is stuck up in there. Okay, we talked about question and Quinidex. Any questions? Like what I told you, there may be days wherein we probably won't be able to do math, or we'll have 15 minutes of math only. We did abbreviation already last Friday, right? We did abbreviation. So we're done with, are you sure we did abbreviation? We did, right? We're done with abbreviation. So tomorrow is quiz on drug words, week 4, same axis. There will be 1 drug words, 1 abbreviation quiz, each 45 minutes. Put this in your calendar, okay? It opens at 7 a.m. and closes at 2 p.m. Okay, last question. Who wants to go to the campus Thursday? This is outside of the Friday, okay? Thursday, 9 to 12 for extra labs. I just want to ask because I'm opening this for students who are trying to catch up. This is a catch-up day. Thursday will be a catch-up day, 9 to 12. Okay. Friday will be 9 to 3 for others, but for you guys who are going to be with me via Zoom, it'll be 1 to 3. This is IV. That clear? You don't have anything to catch up at this point. Okay, but you can start working on prescriptions for other labs. Okay, any questions? No one on Thursday, just Friday? Hands up for Friday. Kevin, Tony, Robert, Atziri, and Jess, will you try? Eileen too, Friday. Jess and Atziri, same. Can you give me a heads up? Email me if you're joining so I can add you in. Perfect, okay. I'm going to say let's come back for 10 minutes. Meaning, I'll send you on break from 11:40 till 11:50. We'll come back 11:50 till 12 and do 1 worksheet. Okay, 1 worksheet. Okay, where are we at on the worksheet? We did 2 last time. So what's the 3rd one? Roman numerals. Roman numerals, have your Roman numeral. Jess's face is like, I know it can be confusing, right? Okay, so Roman numerals, we come back at 11:50, 10 minutes of Roman numerals. Set your alarm. I'll see you guys in 10 minutes. Bye.